Um, Welcome to the 4C Conference webinar series. We very much appreciate you attending today, appreciate your participation, the support. Today's webinar presenter is Ben Chandler of GHD. We'll be talking about ethylene oxide. We very much appreciate you taking your time today, Ben, to share your knowledge, and very much appreciate the support of GHD services at the 4C conference. Without further ado, Ben, take it away.
What are you talking to me? Sorry, I'm listening to a webinar.
Yeah, good afternoon.
Sorry, get that muted here.
Wish I could nap.
No worries.
Hey,
Yeah.
Todd, can you mute that? There we go. Okay, Ben, now sorry. Now take it away.
Sure thing. Yeah. Thanks, Steve, for having me back. And very excited to hear that the 4C conference is going to go live here in August. Would be great to get back out and see a lot of you people here that are remotely in person. We did present on this topic at the last conference. Wow, seems like such a long time ago, 2020 in February. Had a lot of really great discussions. I think we had about 15 to 20 people that sat in on this original presentation, and hopefully we can have the same correspondence here. I know always great to have questions, so I did see the chat function is available, so anyone that has questions, Steve, if you see a good question and want to interrupt, feel free to do so. A lot of great information to be shared, not just from my end as well, but welcome to hear others that have comments. What I'm going to talk about today, and before I do get started, there is another colleague that's here with me today. We're actually in our office here in Little Rock. His name's Darren Hamlin. Darren also works with GHD. Just happened to be here today. We've worked together over the last couple of years on many of the projects we're going to talk about today. So he'll likely have some good input as we go along. You can't see him; he's in the room. We're socially distanced, trying to stay safe, but wanted to introduce him as well. What we'd like to talk about today is some of the latest updates involving ETO. Both Darren and I have worked on several projects, both monitoring for ETO and sampling and evaluating different sources. Starting in Willowbrook, kind of where ETO started to get some national attention with some of the sampling done there. Those efforts progressed to other counties in Illinois. Have since we've done projects in several other states as well. So I'd like to bring a lot of that knowledge to bear here. I know a lot of you may have facilities that you're working in that either handle ETO or in another industry that uses ETO as part of your process. So hopefully the information that we've gathered and the things that we've learned really going back to 2018 will be useful to the group here. A little background before we kind of get into the meat of the presentation. Ethylene oxide, is fairly prevalent throughout industries in the United States. It's a very common chemical that's an intermediate in a lot of processes. So a lot of the focus of the sampling and efforts to date have been, focused around the medical sterilization industry. However, ethylene oxide is very common in different areas. So one of the things you see in addition to the chemical industry is manufacturing of fiberglass. It's a component of that process as well. As you look to the right in the photo, the medical sterilization industry is certainly one that has been identified as being a potential source as well. It's an ingredient in industrial cleaners. Many of the stronger type cleaners that you see out there do contain ethylene oxide as part of that process. Use glycols for engine antifreeze, and then personal care products. So may not be known to the group that actually some of the cosmetics that are out there on the market do include ETO. It is a known carcinogen, so some of the health risks should be fairly certain with the group here. But yeah, known carcinogen by the NTP, National Toxicology Program, which is part of the U.S. Department of Health and Human Services. It's a Group 1 carcinogen by the AARC, International Agency for Research on Cancer. Potential human carcinogen with NIOSH. NIOSH, of course, for the group is one of the research arms of OSHA that looks at occupational health hazards in the workplace. It's suspected human carcinogen, classified as A2 by AGCIH, identified as a cancer reproductive hazard by OSHA as well. Then you see some of the common cancers that ETO has been linked to. A lot of the health effects behind some of these designations are listed here. In addition to being a carcinogen, ETO is considered a skin irritant. So health and safety and environmental professionals in industry need to account for when they're doing PPE hazard assessments to account for ETO being a potential skin irritant for workers. And then lastly, the main target organ is the central nervous system. Some of the physical properties, it's extremely flammable under pressure. ETO is transferred by rail. So one of the things that we've encountered, both Darren and I are part of our emergency response group as well within GHD. So we get the unique opportunity to go on, different upsets and events that could be happening. And so one of the things we've been involved with in the past is actually responding to train derailments that have involved ethylene oxide. So with it being as flammable as it is, it's very common that if you have some kind of spill, it's a very high potential for a fire hazard or explosion in case of a pressurized liquid. In the case of the trains, it's highly reactive. You see the flammable range there, 2.6 to 100%. So it kind of tells you how volatile, how potential there for being a flammable hazard. It is clear and colorless, which we'll talk about a little more in detail as we go along. But this is certainly comes into play from an occupational standpoint with warning properties not being as prevalent for ethylene oxide in the workplace. It does have a sweet odor, which has been reported in industrial settings. Some of the literature out there does describe that smell as being compared to the smell of bruised apples. We also kind of hear about a ether type smell. It does have a pretty high odor threshold. I think the ATSDR listed around 500 ppm. I know there's others out there that may be a little lower. But again, warning properties can't always rely on some of these properties when in the workplace. There are some great methods out there for measuring ETO in an occupational setting. The three primary routes of exposure for workers are identified here. Inhalation, mentioned eye contact. There is potential for skin contact and absorption as well. Then you see the occupational exposure limits listed below. with the OSHA PEL of 1 part per million, which is the same as the AGCH TLV 1 part per million. These are both based on an 8-hour time-weighted average. OSHA being the regulatory limit that's enforceable by OSHA compliance officers in the workplace. So if you have a OSHA inspector come in to do some kind of assessment or investigation or open an inspection, likely they're going to do sampling, and if they do, they're going to compare sample results to that 1 ppm. There is an OSHA STEL as well, and it's 5 ppm. The STEL is generally applied to specific work tasks that have a potential higher exposure to ETO. So work tasks where common ones would be if you're opening a vessel that contains pressurized ETO, or otherwise handling ETO where exposure in the breathing zone is greater versus other tasks. Those are typically the types of work activities that OSHA will target for their sampling for comparison to the STEL. The last one you see here is the NIOSH IDLH limit. NIOSH, this group identifies, also evaluates workplace hazards, and one of the things they identify is IDLH atmospheres, immediately dangerous to life and health. This is an atmosphere that could have some significant health effects at an acute level. So 800 parts per million is the threshold that NIOSH has identified as a potential IDLH atmosphere. The next thing is, we have here, this is a presentation we used back in February, and at the time, real-time capabilities were fairly limited. There were a few options out there for measuring ETO. I can say since February, within the last year, with the uptick and the much larger interest in evaluating ETO levels, not only in the community but in the workplace, we've seen a lot more vendors take on this challenge and identify and establish other instruments for real-time monitoring. So I won't go into any details here. Certainly not going to recommend any type of equipment, but our team continues to evaluate new technology that's out there, and we've actually done some trial assessments of some of the equipment that's been out there, and done some side-by-side monitoring and other things to evaluate their capabilities. But with this new technology, there's a great potential that with new equipment that's going to greatly enhance the capabilities of EH&S professionals, industrial hygienists, and other people here in this industry to evaluate these ETO conditions. I know one of the drivers is really that detection limit with the new community-based health criteria, looking at really low detection limits. It is critical for these air monitoring instruments. It's been the main reason why we've relied upon primarily the laboratory methods to date. What we'll talk about today mainly is a lot of our air sampling strategies, but as this equipment continues to evolve, we'll likely see these instruments involved in some of these studies. Yeah, and lastly, on the compliance piece, there is an OSHA substance-specific standard. It's listed here, 29 CFR 1910-1047. This is the substance-specific standards for ETO in general industry. Much like the other substance-specific standards such as lead, benzene, cadmium, there's others. There is a list of requirements that will be triggered if you exceed, for instance, the action level established within the standard. or the PDL. Typically, those are the triggers that will require the employer to implement the programs you see here. One of the first steps is worker monitoring. Again, going back to the previous slide, there's several different methods that are out there. One used most prevalently is, the passive diffusion monitors. That was one of the photos in the previous slide. It's a very simple method where you're flipping that passive monitor in the breathing zone and send it to a laboratory for analysis. Beyond that, there are requirements for medical surveillance and training. Anytime there are exceedances of an action level or a PDL from OSHA, the first step is to look at engineering controls. But in the absence of effective engineering controls, then respiratory protection is an option for controlling exposures as well. Which is a good segue here. So what we've listed here is the NIOSH respirator recommendations for controlling ETO exposures. The one that we've seen most prevalent in the workplace, beyond the work we've done recently with community sampling and evaluation, we've also done a significant amount of work in the workplace evaluating ETO hazards during processes. So the one we've seen in most abundance is using a full face air purifying respirator, or APR. That's the one you see here on the right. It does have a sign protection factor, APF, of 50, so that indicates if used properly as part of a effective respiratory protection program, it is capable of reducing exposures by a factor of 50. And then the next bullet you see is what NIOSH recommends for emergency situations is an SCBA, self-contained breathing apparatus, and that has a assigned protection factor of 10,000, so a much more protective respirator. And then if you go down, the next thing we've learned is it's very interesting to see the differences among recommended respiratory protection across suppliers. So some of the suppliers that we've identified in the industry have requested or recommended rather that supplied air be used for worker protection rather than APR type respirators. And so some of the reasons for that is poor warning properties. So with the high odor threshold, the fact that it's a colorless gas, the fact that it's high in toxicity, it's been interesting to see that some of those changes beyond recommending beyond just the APRs. Yeah, and the last thing we want to talk about before we get into some of the project work we've done with ETO is just list some of the environmental parameters that are out there. It is EPA listed hazardous air pollutant. There is triggers within the OSHA process safety management standard, what you see listed here, 29 CFR 1910-119. So if you meet some of these threshold quantities for use, then you will be triggered by this OSHA standard as well. And if you look down, there are other environmental stipulations that account for ETO as well. So how we got here? Why are we still talking about ETO 2 years later? What has triggered a lot of this national interest in this emerging chemical? And I think Darren and I had the opportunity to get involved in the early part of the assessment in Willowbrook. For those of you that may not be aware, Sterigenics is a medical sterilization company that has a facility in Willowbrook, Illinois. Willowbrook is a suburb of Chicago, probably, I don't know, 20 miles or so southwest of downtown Chicago. And within that community, you have the Sterigenics facility, and you can see the photo on the right is actually one of the photos are from the figures taken from our recent EPA report for that area. You essentially had two buildings used for sterilization, and sharing perimeters and fence line with commercial areas as well as residential. And then even across the street directly, you had municipalities with the police station and some of the other municipality buildings. So EPA decided to conduct a study around these facilities. So they collected air sampling beginning in the spring of 2018. And as a result of some of the samples collected, these are air samples, sorry, as part of some of these results, there was a report that was released subsequently that same year. Once community members in Willowbrook were aware of the report by EPA, started to have some concerns. These concerns were primarily pertaining to EPA's findings that there was a increased health risk for the residents of Willowbrook to ETO as a result of fugitive emissions from the Sterigenic facilities. As you can imagine, the public, looked to the village of Willowbrook, their administrators and the mayor and other public officials for answers to some of these health concerns. And so, as is usually the case, lawsuits are often a result of findings such as this. So we saw that very early on in Willowbrook. And so when this was going on, the mayor of Willowbrook decided to convene a task force of experts. So Darren and I and others were asked to be a part of this task force. In addition to us as industrial hygienists, it included toxicologists and other engineers with specific capabilities for assessing ETO. And the primary objectives of the task force were kind of twofold. One is to do some measurements within the community to characterize levels. And the second part is to understand what background concentrations of ETO. So in addition to some of the known sources, we wanted to look at what ETO characterizations are outside the 2 to 5 mile radius of the Sterigenics facilities and other sources. So when we're putting together sampling plans and starting to drill down and to assess risk for the community, these are some of the things that we were considering as part of that planning. We ended up collecting samples. The initial sampling project was for 30 days. And then after that, subsequently, additional follow-up sampling was conducted throughout the year from 2018 through 2019 in different intervals. We collected air samples. The sample locations were selected again to characterize both background, urban areas. We want to look at ETO concentrations in rural areas. We wanted to look at ETO concentrations in residential areas, as well as in areas that didn't have populations that were as large. Ultimately, the Sterigenics facility was closed down. The Attorney General with Illinois made that decision within that same year after sampling and this report was released. To this date, multiple lawsuits are still continuing in the region with litigation still moving forward. To my understanding, Sterigenics has ceased operations and has not opened these facilities since being shut down in, I guess it was early 2019. So a little background, continuing on, one of the initial challenges for the task force was identifying good laboratory methods and establishing air sampling protocol. Again, having great options for worker exposure monitoring and sampling with detection limits needing to be much lower. The methods for doing the occupational sampling just weren't a good fit for this monitoring. So one of the first things we wanted to do was challenge a lot of the laboratories that we work with regularly to come up with good detection limits. The same EPA ETO 15 method is what's being used for ETO. It has been used in the past. One of the things we want to look at in addition was what are the differences, if any, between indoor concentrations of ETO versus outdoor. So in many of our sample locations, we would co-locate a sample indoors. For instance, if we were doing sampling at a particular residence, we would want to do collect an air sample outside on the property, as well as collect a sample indoors for comparison. Then we want to look at other sources. So other sources of ETO, a lot of information out there. We felt there was a lot of things for us to evaluate on that aspect as well. So looking at other potential sources of ETO were part of that as well. Then as I mentioned, we want to understand what background concentrations of ETO are in rural and urban areas. So that way we can get a better understanding of what the contributions are to the ambient levels from other sources. So what's being done to understand the risk? What we've learned since Willowbrook is there's a lot of interest, not only with municipalities, but we've seen sample projects that we participated in since Willowbrook for most of the groups listed here. So we've been retained by different county health departments to do sampling. Lake County is a great example. That health department of Lake County actually pretty soon after we did the sampling at Willowbrook, asked us to come in and do additional sampling on behalf of Lake County. In addition to that, there are other sterilization companies that we have also done sampling on their behalf as well. Again, our charge within GHD is to look at this objectively and collect good data. We feel like the more data we can collect, the more we can find out about contributions of ETO, in the community, the better decisions we can make to keep community safe and come up with good control measures. Other groups are industry trade groups. So you've seen groups like the American Chemistry Council also kick off sampling campaigns. We actually did some work for this group down in the Atlanta area here recently. Atlanta, like Illinois, seems to be a bit of a lightning rod for ETO as well, with a lot of interest, a lot of sampling campaigns being kicked off in that area as well. There are a lot of advocacy groups. We haven't worked directly with any of these groups to date. One that was very prevalent in Willowbrook was the Stop Sterigenics advocacy group, and you can see to the right of the slide a photo of one of their logos. If you were to to be in Willowbrook from 2018 to 2019, you would see lots of billboards, lots of signs in residential areas for this group. They were a very active group in organizing protests and participating in community meetings throughout the early stages of our sampling there. But the point I really want to make here is, in our opinion, we're very used to working with industry groups to do sampling, but to see the number of municipalities, state, county government, and health departments kick off sampling campaigns was very interesting. Especially Willowbrook funding a large sampling effort with a task force of 4 or 5 people, all being consultants was I thought was a big deal. That is a large undertaking for a small village like Willowbrook. So I think that is the norm these days, is to see some of these groups take a more active role in answering some of these complicated questions with public health. In addition to that, I did mention, medical sterilization companies, obviously are taking notice of some of the things going on with ETO. So we've had the opportunity to work directly with some of these groups as well to do sampling. In addition to that, the chemical industry, we were talking a little bit before the call started here. Sounds like we have a few people in the audience today that are working in the chemical industry. So these are certainly groups that are looking to evaluate, potential for fugitive emissions, get without their perimeter of their facilities. The last one's transportation. So we mentioned, railroads being one of the groups that's used to transport ETO. That seems to be one of the more common modes of transporting ETO is by rail. So certainly that's a group that wants to understand potential risks during transportation of ETO. Then the last thing we're seeing is a lot of additional measures are being implemented. I know a lot of the groups that we've worked with directly have taken the approach to be very proactive, both in doing sampling around the perimeter of their workplaces and proactive in implementing control measures in some of the vessels that contain ETO while on site. Yeah, so this slide really, if you're not aware of the differences between the health risk criteria, this is really where the national debate stands. So you have a lot of different groups with vested interests and opinions on what the risk to the public is for ETO exposures. And what I've listed here is the different health risk criteria. The first one is the EPA's, and the next is ACC, which is the American Chemistry Council. And then just for reference, we have the TCEQ, Texas Commission for Environmental Quality. And you can see the orders of magnitude different with EPA's 0.003 compared to 1 and 0.4 for TCEQ. So these are the 1 and 10 to the -6 risk levels for each of these. And so I see very, very low limits in the ppb range. But again, the point here is just the difference in what that risk level is. And so, and I guess just to add the TCEQ, just to make a note that a lot of the state environmental commissions have taken upon themselves to come up with their own risk criteria that's applicable to their state. And Texas was one of the first that I know of that took this on internally to come up with their own levels. And so that's what they've done here with the 0.4 ppb. Then you can see the photo on the right is a picture of one of our sampling canisters that we placed along the perimeter. I think this one is in front of one of the municipality buildings in the village of Willowbrook. That's actually one of our duplicate samples. So we've got two canisters on a tripod, which is basically what we've been using. So we use the 6-liter Suma canisters. So those of you on this call that have done ambient sampling likely have used a canister like this. They're the larger volume canisters compared to some of the smallers that are available. We use a 24-hour regulator. That's what you see fixed atop each of the cylinders. So we can get an average sample based on that 24-hour sampling period. We're using EPA TO15, so it's gas chromatograph mass spectroscopy analysis. And the next thing to point out is we have used multiple different labs. I think we've used up to 4 or 5 labs across the different projects that we've been a part of, all using TO15. But the approximate detection limit across these labs is typically around 0.02 parts per billion. So those of you that are paying attention, you can look at the EPA criteria 0.0001 detection limit, of course, is above that. So essentially, that was also a challenge, is when we're comparing results that we've obtained for different sampling events to the different health risk criteria. That detection limit being what it is, does not allow us to effectively compare it to that EPA method. Essentially, any detection that we find is going to exceed that EPA limit. One of the things we've identified is this method has, it's been very interesting to see the differences among different laboratories and some of the reporting limits. We had the opportunity to do a lot of side-by-side sampling with the EPA, in some instances with other consultants that either have been retained, by a different group in the area, whether it be industry or another municipality. So some of these stations can tend to be a little crowded with the amount of canisters that are out there, but we continue to look at the different the difference between some of the labs and some of the reporting that's out there. And one of the things that was identified in some of the EPA sampling is they identified an interference of trans-2-butene early on, and some of the samples that they had analyzed. And we suspect that as time goes on, we're going to learn more things about this method.
And 2 things I would add: the ACC, their most recent value, when the slide was prepared, they were at 1 ppb. Their most recent value is at 0.245 ppb, so that has been lowered. Their risk value for 1 in a million cancer risk is at 0.245. And then we've also seen some interference with acetaldehyde in some recent sampling. So a couple of things to be aware of at the laboratory level, and some lessons learned there.
Yeah, thanks, Tyron. Yeah, we're still working off the old PowerPoint, so I appreciate that. Yeah, just another example of how as we get more information and as people are continuing to drill down and understand ETO, we expect more changes. So here's some of the parameters of our sampling plan for Willowbrook, and it's been consistent with some of our other sampling efforts as well. We collected over 200 samples throughout the year in Willowbrook. So again, we've got a photo there. I believe that's a side-by-side with one of the EPA samplers, if I'm not mistaken. So you can see that that's a location I believe was in a school area, so we've got it on a tripod. Again, wanted to understand indoors versus outdoors. Each day of sampling or each 24-hour period, we would take into account wind direction, and so we would look at what the wind changes were throughout the day to see if there's any correlation to some of the concentrations we were finding and in and around some of these sources. And a lot of these projects, we were able to work and get information from some of the known sources. So some of the sampling we've done in areas that include some of these medical sterilization companies, we were able to get information from their facility management on what levels of operation they were working on throughout each day, so we can try to relate some of the concentrations to some of the operations, whether they're having a particular heavy day of using ETO versus others. We don't have a lot of time to go into the data. That all of the data we've collected, it is posted. For instance, Lake County is posted theirs on their website. The work we've done in Fulton County, in and around the Atlanta area, also available on some of the municipalities' websites. But in general, we've consistently found background levels. When I say background, this is 2 to 5 miles or more away from a known source like a medical sterilization company. We found that above the background, above their EPA risk criteria. So this accounts for rural areas as well as urban areas. We've also found positive detections indoors, so inside schools, inside residential areas, inside commercial type facilities. Where we've done this type of sampling, we've also found detectable levels of ETO. Yeah, so where are we going next? With all this national attention on ETO, where do we see the advancements? Where do we see the changes? Where do we see these levels of exposure assessments going? And really what we're seeing is all this group listed here, from sterilization companies down to national and local trade organizations, are all what we found is all these groups are taking their responsibility and conducting their own studies. So since Willowbrook, we've seen just in the projects we've worked on for all these groups, an uptick of over 1,000 samples being collected since Willowbrook. So within the last 2 years, we've seen a lot more data being collected, and that's only going to help the H&S field and professionals to make good decisions and understand contributions to ETO. Yeah, and before I jump off, those of you that haven't seen the medical sterilization process before, this is an example of one of the chambers that's used for sterilizing medical equipment. What happens is there's a whole host of different types of containers for sterilization, but this is one of the larger ones where they would bring in the materials, set them on the racks, close the area, and then they would introduce the ETO, and then let that ETO dissipate, and then depending on the process, that could take different intervals, and then once sterilization is complete, that ETO is evacuated, and the medical materials are sent back to to the hospital or the clinic or wherever they're going to be used. So these are the challenges for public health experts and industrial hygienists and toxicologists in the field. I mean, the first thing is, we're comparing air sampling data that we collect for a 24-hour period. And let's say our sample plan calls for 30 days of sampling. So that data is great, it's helpful, but one of the challenges is trying to extrapolate and compare 30 days of data to, a long-term cancer risk. And that's just, just a product of, the lack of data in the community prior to some of these studies beginning in 2018. One of the things that we continue to learn about is contributions from other potential sources. Understanding that different chemical processes that use ETO, quantifying those is something we're used to doing, but understanding other sources of ETO, again, going back to the large number of samples that we've measured above EPA criteria in rural areas is certainly something that needs to be studied in more detail. And then the last thing we'll talk about, is just the sampling methods that are available. Again, I feel like real-time technology as it advances will be a big driver to help continue some of these assessments. But in addition to that, I feel like the laboratory methods that are being used by different labs are certainly something that will continue to be looked at by those that are doing these assessments. And it goes back to the last Can you guys hear me?
Yeah, apologize for that. I've been muted.
No worries. We thought it was our end, so glad to hear. This is really our last slides before we open it up for some discussions. But this is kind of where we see ETA going. Certainly, with the COVID-19 virus becoming such a big issue in March of last year, we did see some of the shifting of attention away from ETO, but we've at least seen in the last few months a lot more interest from communities and trade organizations to look back into ETO. So we feel that will continue. It's been our experience that a lot more questions have revolved around ETO. So we feel like we're kind of getting back to that level that we saw early on with the Willowbrook project. One thing to mention is a lot of medical sterilization and other facilities have made a business decision to close their doors, if not temporarily, for implementing control measures. But some have decided to close their doors for good. And we've seen this in communities where you have these sterilization facilities within residential areas that have just for lack of a better description, just pressure from the public and other municipalities and other things to make some of those decisions. And the last thing, we mentioned it earlier especially with the Willowbrook project, is that we're seeing a much bigger uptick in local government taking initiative to fund different studies and to look to get answers for members of the community. So that is the end of the presentation. My contact information is here. I am always excited to talk about ETO. I wish again we could have been in person to do this presentation, but I encourage anyone with questions or would like to discuss anything regarding ETO. I know there's vendors out there that have technology. We're very interested to know about that new technology that's out there, so we can begin to implement in some of the ongoing studies that we're working on today. So Steve, that's all I got. If you want to open it up for questions, or you tell me.
Yes, thank you very much, Ben. Yes, there are some questions that I'll pull off the chat line here. Is ETO a greenhouse gas?
It is not a greenhouse gas, no.
Okay. There's a mention of ETO being detected in background levels. What were those levels? And you had mentioned ETO being detected in rural areas. So is there a background level of ETO?
Yeah, so again, we did a lot of studies. So just talking about the data that we've collected for different projects, that's going to vary. So each site's a little different. Some of the levels in Illinois were different than some of what we found in Texas and even in Atlanta and Georgia and the areas. But the point I was making in the slide is, we found it above that EPA level. So any detection that we had on any of our samples, because of the detection limit being what it is and being higher than the EPA criteria, any detection that we had is essentially going to be above that EPA 1 in a million risk criteria.
If you detect within 5 times the detection limit, is that reported as a 0 or reported at the value?
We reported it differently. It was all each project again being a little different. Oftentimes we would just report that detection limit. So if we have a detection limit of 0.02, we would say it would be less than 0.02 as a ppb concentration. Some studies that changed. Some of the stuff we did for some of the health departments, we would call it non-detect in some instances.
What is the atmospheric half-life of ethylene oxide?
That's a good question.
Yeah, it varies in the literature. There was a bit of I think misinformation around that at the outset of some of these projects, where it was an extremely long, in the order of 60 days half-life. There are some smog chamber studies that were conducted. So ethylene oxide in and of itself, if it's isolated in imagine your frictionless vacuum experiment, may have a longer half-life, maybe even pushing up in that many days long range. What we find is that in normal environments, and hence the smog chamber studies where there is something for it to react with, that half-life drops to the order of hours. And so it really depends on the environment into which it's released. But I would say that is another subject that deserves a bit more investigation. But in a typical environment, especially a typical urban environment, it's a fairly short half-life due to its reactivity.
Okay, thank you very much. The EPA has taken action off of this study. Is the DOL or OSHA revising worker exposure limits based off the same data?
Yeah, so the data collected by the EPA, specifically, similar to the Willowbrook study, is designed to look at, community exposure. So, to my knowledge, OSHA hasn't made any changes to the occupational exposure limit. As far as I know, that's still at 1 part per million with a STEL of 5 parts per million.
Would you expect to measure high ETO levels downwind of an overheating car due to ethylene glycol and the coolant being vaporized?
Say that again.
This is a specific question. Would you expect to measure high ethylene oxide levels downwind of an overheating car due to ethylene glycol and the coolant being vaporized?
Yeah, I mean, we haven't looked at that particular example specifically. I mean, we have done. There is an argument out there that, you know, high traffic areas, and a lot of experts have concluded that high traffic areas can contribute to, you know, higher concentrations of ETO. I think that is under the category of, you know, something that is still being evaluated. I know some of the locations selected on some of our other projects were designed to be in high traffic areas by design to see, you know, what those impacts are. I have not looked at, you know, a downwind location specifically to an overheating car and what those contributions would be. But I mean, that's a great question. I think that's one of many that people looking at ETO are asking those same questions.
Okay, one last question because we're running up against the clock here. It's 2:01. What were the most significant changes between the time you did this presentation at the conference in 2020 and today, the date of the webinar?
Yeah, I'll answer first. I'm sure Darren has other examples too that he can add, but I mean, I think we just have a lot more data now. I mean, 2018, I mean, prior to that, there was a few really old studies that were referenced for you know, looking at community ETO. And so I think just the amount of data that we have now, and I mean, to the question earlier, is we're starting to look at what some of these other sources of ETO are and understanding what their contributions are. So I think that's the main thing, is as we continue to get data and understand more of what this complex issue, you know, what's causing these levels is the main thing.
Yeah, I would say there's also some real potential around some real-time monitoring, you know, as we move to more of that sort of fence line monitoring model, you know, that are showing promise that may be useful. You know, we're still looking at the whole air sampling as kind of the benchmark, but certainly some real-time, you know, methods that are showing promise. And then, you know, the change I mentioned in some of the toxicity limits, I think that's, you know, continuously being evaluated and reevaluated now against what we're seeing in the larger data set as being, you know, pretty confidently what those background levels are, and weighing that against the incidences of some of these cancers, and, you know, whether or not what we see on the ground and in, you know, our experience is reflected by the, you know, the causal questions that are surrounding, you know, this as being a causation of these cancers. So that's sort of the toxicity side of the larger data set, I think, is becoming more useful to us to make that analysis.
Excellent. Okay, thank you all very much for conducting the webinar today. We very much appreciate it. It's super informative. That will conclude today's conference or webinar. Thank you all for attending, and thank you very much, GHD, for conducting the webinar today. Take care.